Hello and welcome. This is Sake Online. My name is Zenzele Ndebele, and the program is, Surviving COVID. This is a program where we talk to COVID survivors, sharing their stories about their COVID experiences, how it was, how did they discover that they had COVID, and also what they went through. Today in my program, I'll be talking to Sandra Nomasiko Siziba, who recently recovered from COVID, and we want to hear from her. Sandra, good morning.
Morning. How are you, sir?
I thank God that I'm alive.
Amen.
Yeah, at a time when everyone is really getting sick or dying because of COVID, it's always a privilege to talk to people who have survived this disease. So share with us your experience. I mean, at what point did you say, "Ala percent the COVID"?
Right. My journey started like this. I woke up on Monday. It was on Monday. Let me check my dates. It was on Monday, the 28th of June. So I had a slight flu, but I just ignored it. I just thought maybe it's my sinuses at work. So I usually take some tablets for those sinuses. So in the morning I took them. Then I said, I know it's going to go away. It was on Monday. On Tuesday, the flu intensified. It was a now full-blown flu, and I was like, maybe it's one of those flus that you get maybe once in a year. It becomes hectic, and then it goes away. It didn't even cross my mind that it could be COVID. At that time, I told myself it's flu. I was presenting flu symptoms. Then it progressed. It progressed. On Wednesday night, things got really hectic. I had a severe headache. I had pain in my shoulders, in my back area there. Everything was just painful. So when I told my husband that, no, I think I'm sick now. I think this flu is something else. And he said, no, let's go to the doctor. So it was 3 days on now. So we went to one of these local doctors. We presented our symptoms, and the doctor told us, no, you seem to be stressed. Your symptoms are those of stress. So he prescribed some meds. We went to the pharmacy, we bought the meds, and then he was like, today these are going to help you sleep and relax. Tomorrow you should be fine. So we came back home. We took those meds. I took those meds. I went to bed. But in the middle of the night, I woke up with a terrible headache. Now my head was like pounding. I couldn't even lift my head from the pillow. It was bad. So on Thursday morning, I couldn't even get out of bed. My whole body was aching. My chest was compressed. I was having difficulties in breathing. Everything was painful, bruh. Everything. I couldn't sit up. I just couldn't help myself. So we called this other nurse friend of ours. She's a local nurse. We talked to her. I talked to her about the medication that I got the previous night, and she said, no, maybe those meds are very hectic for you. Since it's the first day, why don't you be patient? Maybe tomorrow you'll be a bit better. It usually happens when you're starting medication for the first time. But a part of me was telling me, no, this is way worse than what we are thinking. But well, since we trust people on the medical field, I took the medications the second time. And then when I woke up the following day, I was sick. It was bad. We rushed to one of the doctors by the CMAS building there. When we got there, she didn't even write anything on my card. She said, this one has COVID. don't even think about doing anything else. Just go to the next building and get tested. This is COVID, and you are just going to kill this woman saying you're treating her with stress. She's not stressed, she's got COVID. We had to rush next door. We took the test. They told us to wait for 2 hours. My husband took me back home. Then he went back to the clinic to get those results. And when he came back, I had tested positive for COVID.
So at this point, you are interacting with your husband, and he's helping you, he's taking you to the hospital. He thinks you have stress. He doesn't probably suspect that you have COVID.
No.
So, yeah. So when you get the result,
not even by any chance did I suspect, because I even that confidence and consolation of saying, no, I got my vaccine, I'm fully vaccinated. So there's no way I can be positive. Maybe the test is just going to tell us it's not COVID, and then the doctor is going to look elsewhere again.
So you get the results. What's your first, how do you feel? How do you respond?
To be honest, I was mad. For a moment, I was really mad. I kept asking myself, okay, I've got COVID. How come? Because in my mind, I was telling myself, no, if you're fully vaccinated, that vaccine somehow protects you. And here I was very sick. During that time, I don't want to lie, I was very, very sick. And now I had tested positive. Just the mere mention of COVID, it sends shivers down the spine. I saw myself dying, because for a moment I was looking at this COVID that we usually see on social media. And I'm saying, I have this, and people are saying there's this Delta variant. Oh my God, I'm dying.
So does the result even make it worse? You now feel the symptoms like two or three times than it is.
I think that positive result makes everything worse, psychologically and even emotionally. It just drives you to the edge. I just lost it. And my husband was saying, no, this thing, you can beat it. You don't have any underlying condition. You're perfectly healthy. So you are just going to beat it. At least now it's good. The doctor knows what she's treating. So any other medication that she's going to prescribe for you, it will be from a point of knowledge. Unlike what we got on Wednesday. He tried consoling me, he tried comforting me, and he even begged, because when the results came, it was way after 1, and it was on Saturday. So most those clinic and surgeries would have closed at 1. So now we were talking to the doctor via phone, and she was insisting, no, take her to the hospital, take her to UBH now. Don't keep her at home. Now we know she has COVID. She has to go in, because she was presenting symptoms of having difficulties in breathing. So the doctor was insisting. Now I was also at loggerheads. I didn't want to go to the hospital. I was scared.
So do you decide to go, or you then said, no, I'm going to stay at home?
I literally begged my husband. No, I promised him, no, I'm going to cooperate. All these home remedies that we see, I promise I'm going to cooperate. And he also begged the doctor on my behalf, no, can we keep her at home? We will call the ambulance once maybe the sickness intensifies. But at the moment, can we stay at home, let her take the medication that you have just given her, together with the home remedies? And if things get worse, that's when maybe we are going to request to go to the hospital. So the doctor ended up allowing me to isolate at home. And from there onwards, we had to shift things. My husband had to move out of our bedroom. Our kids who sleep right next door to my bedroom, they also to shift to the other side of the house. So I had the other side all to myself. I was going to isolate there.
So yaqala ke lapho indaba yokufutha.
We isifutho samaziyoni ngasibamba. Some days during the first, I think it was the first 3 days, I ngangifutha for like 4 times a day. Ngifutha ekuseni, mid morning ngizwa engani sokusiba nzima because my chest was very painful. Ngizwa ngani ukuthi I would request, please boil water for me, please do this, please, and they would cooperate, they would do it. Everyone was just awesome.
That's the time when you get maximum care, because about
yes.
But everyone everyone is willing to help.
My family was awesome. I thank God. Isifutho babesibamba bengifakele gumtree, all those gumtree, isawudo lamagade, they would put umsuzwane, they would mix. Yonke the advice that you would get from people would do it. Bangenzele, the food was awesome, always warmly cooked. They took care of me. They took care of me.
Yeah, you know, you're mentioning one thing, which gonna everything that people were telling us we would do. So, when you look back after recovering from COVID, you laugh at the different concoctions that you tried, and everyone would say, no, fagi lemon, ulifage, omunye tifagi orange, omunye tifagi umsuzwane, gumtree. At that point, everyone becomes a doctor.
Now that you mentioned it, the other ones, my other cousin sent me a video of this woman who was chopping onions. You chop your onions, you put them, and then you put them on your chest when you are going to bed. I did it. I think it was day 4. Day 4, I did that. I almost choked to death at night. I woke up, I had to literally throw them out.
Yeah, this is where you find the danger of home remedies, because one amaskale ukuthi kona kuyini okunganani, and also the fact that people tell you all sorts. When I had COVID last year, that is, but my room was so smelling of eucalyptus oil, because I will rub it on my chest whenever I feel like, I'm especially chest having an enzyme. So you rub eucalyptus oil, so it's go the blankets, now fully room, so it's smell in the comes out.
The combination of eucalyptus, tsunami, that's a deadly combination. I almost lost it. I woke up this other night saying that tsunami strong smell. I think it's not good when you are in that situation. So my home remedies, I can safely say no, they are not good when you have COVID. They are not good. Even the concoction here, turmeric and fresh milk and cinnamon, it didn't do for me. It didn't. My body just rejected it. So maybe if it boils down also to the case of saying something might work for me, but it doesn't necessarily mean it can work for the next person.
Yeah, because the challenge with COVID is that everyone becomes a doctor.
Yes.
And everyone has a remedy that probably sometimes there's no scientific evidence.
Yes.
And we tend to ignore the doctors because we feel like, our doctor, despite the fact that we need tablets, we go and look extra.
But what I would like to say is, once you are in that state, once you have tested, once you have seen your doctor and your doctor has prescribed medication for you, I think the first point of call is to rely on that medication and take it faithfully. I did that, and I think after 2 days, the pains disappeared. The headache stopped. I finally got that relief. I was now working on the chest pains, the chest contractions, and all that, but the physical pains, even on my skin, they slowly subsided. I was able now to see the light at the end of the tunnel. After all, I was now hopeful that I'm going to beat this. I was now very, very hopeful because I was no longer in so much pain.
Yeah, it's and maybe I think what people should be cautious with when we use home remedies. I think some of them work for certain symptoms. Now the flu, ungafuta, I think kuba relief nyana nje for a certain period. So that is it. So you so isolated lapha. Did other family members go and test?
When we went to isolation, the first day when I got my results, the city council nurses, they phoned me. They asked me a couple of questions. Was I fully vaccinated and all that? I supplied that information. And then the following day, the rapid response team came. So my husband was also fully vaccinated. I had my 2 sons. The other one is in Form 6, and the other boy is in grade 2. So when the rapid response team came, they tested my husband, they tested my sons, and then they went and they phoned us the following day, end of the following day, they told the other guys their results. No, you are COVID negative, which was a relief to me because I was now worried. So now the bugs were with me. I was the only one who had COVID at home. So, yeah.
So how long does it take you to, fully feel like you've recovered? WhatsApp.
I think me now, whilst on isolation there, on my day 7, day 8, that's where I gained my strength. I was now updating people of how I was feeling. No, today I'm fine, I'm feeling this, I'm feeling that. But I could feel that I was able now to communicate with other people because I had totally shut my phone. I had switched it off and put it away. I felt like, no, people are going to judge me. I have COVID. So even looking via WhatsApp, I feel it's making things worse. I was overwhelmed. So I just stayed away from everyone. The only people that I was talking to was my family. They would call me. We've got an extension phone in our bedroom. So they would call when I'm in the sitting room. Mommy, how are you? How are you feeling? No, I'm okay. Can you please bring me some water? They would bring warm water and put it on my door. They would knock. So I felt that kept me going. The outside world, I'm being judged or they will make things worse. So yeah.
I can imagine extension for the ringing every 30 minutes.
My little one, the grade 2 one, is fussy. He's so touchy. Because, Mom, can I come and hug you? Mommy, I miss you. Because sometimes you just come into our room. Can I sleep with you guys? So now I was alone there. He couldn't come into my room. Sometimes he would go, you knock on my window. Then I'll open the curtains, just waving and all that. And you would call me extension, Mama, are you okay? Mama, can I come even for 1 second? And then towards the end of the isolation, that's when I would say, no, you can put on your mask, you can come open the door and stand by the door there. So I think it was a relief for him. He was so worried about his mother.
Yeah, talking about, I was going to ask you how you handled social media, but you've already answered when you switched off the phone. And it happens because one, you decide, who do I tell? And if I tell them, what are they going to react? How are they going to react? Because somehow there is still stigma attached to COVID.
Yes, there is stigma. I don't want to lie. So even when we came out of isolation, I'll tell my husband, no, guys, let's not burden people and put them under pressure to accept us. COVID is very scary. So umuntu domuntu will be fearing for their lives. So ungafaka abantu under pressure ukuthi they have to accept you because maybe you negative, but that fact you were in contact with a COVID positive person, abantu will be uneasy in maybe associating even our neighbors. We would greet, hi, but those close contact or those close, what can I say, close interactions, I tried to limit that. Maybe now that things have stabilized, I'm well now, I'm up and about, but when we came out of isolation, I didn't want that because I was also not completely well. I was still feeling down. So yeah, I didn't want to put myself under pressure, stigma again. It was going to be overwhelming psychologically too.
When you trace back your steps and you say, okay, a few days before I got sick and all those kind of things, and if you were to go back, what would you change? What would you do differently?
I think I'll stay at home. I think staying at home is way safer than anything else. I have always been cautious. I mean, when that COVID situation broke out at Mbakwe High School, I'm sorry to mention the name of the school. I've got a Form 2 son who was there, but when I got COVID myself, he was visiting, so he was not at home. I've got a son who's doing Form 2 there. So when those students tested positive, I somehow got very cautious and very conscious about COVID. Even when I was at work, I'm a teacher myself. So even when I was at work, I would tell myself, these children, they can have COVID and not fall sick. But as adults, COVID affects us way more than them. So I would also encourage my students, please mask up. Let's observe all social distancing, all COVID protocols. Let's observe them, because I knew that it was way bad for us adults more than it is for them. But they won't fall sick. So when I got it, now I was saying, I think staying at home is, even now, I prefer staying at home and doing most of my things at home. Going out, it's very, very risky. It's very, very risky.
I think I would say abantu abasuke bebele COVID. I think you then get a paranoia of trying to avoid crowds, and people who have not gone through your journey don't understand why you don't want to be, mixing with people. Because can you explain to someone who has not had COVID?
My chest was, it felt like there was something that was hardening. It felt like my lungs somehow were not fully functional. Even if noma ngingaze ngikhokhe umoya kangakanani, umoya wawungasayifika phakathi. So ingqondo vele isikutshela ukuthi lapha sokurongo la. So ube le sharp pain also going through your heart. Maybe that sharp pain was because I was now trying very hard to make my lungs overwork. I have to breathe, I have to take in some air, but I ain't that capacity to do that. So I ended up feeling a lot of pain in the chest. Also, I couldn't sleep. Night time was a nightmare. So I would prefer sitting. I would just put continental pillows, maybe I will sit. Because I would see way into the night. That's where I would just fall asleep. But sleep was nicer during the day when the sun is up. There's a section in my room, so I'll just put a small mattress there and I'll fall asleep. I'll be warmer. I'll be comfortable. But it was aggravated. The temperature will be low, so isifuba sihle sibe buhlungu kakhulu. So now when you explain this to someone who doesn't have ongazakayihambi ijeni ye-COVID, someone would tell you, no, hayi COVID uyafutha kuphela, hayi COVID iyaphela. And then I'll say, no, maybe if you get COVID, not that I wish you can get COVID, maybe if you have it, you understand it. It's way deeper than ukufutha kuphela and eating lemons and staying and going out and about. Maybe if you mask up or I don't know. So people, I think abanye basayithatha lula nje indaba ye-COVID. I would see people even in town bezikhululekele nje, hey ngize ngichaya ngolunye uvalo olunzima kabi ukuthi hayi abantu kabakwazi.
Yeah, you know, when it comes to that, like it chest, usually some people will tell you, I even experienced it. Ungalala flat ngesisu, you have relief than ukulala ngeside, sleeping on you. In fact, even after you've recovered, it takes you maybe a week or two to actually sleep on your side.
Mina khathesi, I think sengithanda sleeping position and lami yabonana ukuthi you won't even put a pillow, just flat out ulale ikhanda lakho lifake esayidini nxa uchibile kuchibise futhi ikhanda uyalala isikhathi eside ube lobuthongo sibili obu comfortable without waking up usugaspa for air and all that. So that sleeping position is ideal civilly for your comfort and also for your recovery.
You know, I'm very thankful that you have given us this opportunity to share your story, because not so many people are willing to share their story. But still up to today, there are people who just don't care. The way we are told about there's still people who go to bars. Now, what's your message to someone who's not observing, COVID protocols?
Mina, I think abantu usamele maybe sizwisise ukuthi the only way we can beat COVID is maybe to stay out, try in as much as possible to limit being in crowded areas and maybe decongest. Now, umuntu ewane decide to decongest, the next person let me stay at home if there's no need for me maybe to go into town or to go outside. Kuzasiza kakhulu in the fight in this fight ye-COVID, because i-COVID ihanjiswa ngabantu, imemethekiswa ngabantu. Yikho maybe abanye babesithi kanti kungaba njani ukuthi kube lenye futhi i-lockdown. I feel if that happens, maybe kuzaba lokungcono kakhulu. Ngoba abanye sibili noma bengasoze belithola ithuba lokuthi bayetesta ezindaweni zokutesta, abanye bazagula kube nzima kube buhlungu. But I think indlela yokulwa lo mkhuhlane lo we-COVID ukuthi abantu avoid nje indawo eziningi lezi ezigcwele abantu. Of course we use public transport, but lakho khona phakathi kwe-public transport uyabona nje umuntu engena silayinele ibhasi laphana, umuntu angena ebhasini, the moment ehlala phansi usekhipha imask athi hey bakithi sebe sengikhathele ukuphefumula. Ubusuzibuza ukuthi what gives you the comfort yokuthi phakathi kwebhasi kawukho umkhuhlane? Why can't you maybe uqinisele mask up until maybe you uyefika duzane la ngakini ungena kini ukhipha imask uyayiwatcha uyayilahla wenzani lapho ususithi at least sengingcono sengingoma surroundings are familiar. Kuba unanzelela nje, bottom line ukuthi kanti singananzelela njani ukuthi senzani.
Now, at this point, I think let me thank you for sharing your experience and talking about the mask last time, or the last point. I think it's very important for people to know that ungagqoki mask 1 week bakithi. izagcina ikunika umkhuhlane. You know, wait, nxa ingelembu iwache ufike endlini, nxa ngama disposable lawa, you know, throw it away, because I've seen, hey, amanye ama-mask athola sengcolile lapha sekungokunye mani uzuzibuza ukuthi kathi manje umuntu lo uzwa njani kathi imask ingcole kangaka. So I think we really need to look after ourselves. You know, we can beat this by making sure that we social distance. We try by all means to avoid crowded places. Abadala bayafa, you know, I mean, just like this week, every day, ngamvuka, awubantwana wami interviewayo kasekho, ubani kasekho, uantu ubani. I've lost so many friends. I've lost people who are close to me. I've lost relatives. I've lost people that I interviewed the last year, 2020. I think this week alone, I lost about 5 people that I've hosted in my program, talking about COVID, talking about you know, history and all these kind of things. So people are dying. And my prayer is, can we all, you know, observe, you know, COVID protocols? I am appealing to younger people who are telling themselves, they're still strong. Yes, you might be strong, your immune system might be strong, but and you might bring them the virus. You can also pass the virus to umngani wakho who has amanye health underlying conditions and or diabetes or hypertension, into ezinjalo, that might lead to those people getting seriously ill, and some of them might not make it. So my appeal to you is, please, let's try by all means to, you know, keep safe. This thing is still there until it, you know, reduces. I don't know when. Thank you very much, Sandra, for sharing your story. That was the program that I had with Sandra Nomasiko Siziba. We were talking about surviving COVID. My name is Zenzele Ndebele. Till we meet again in other programs, have a good day.